Now, when you say civilization's fragile, do you mean because of this COVID-19 shit that's going on right now?
Oh, here it comes.
It's this thing.
Yeah, no.
It's like some people just get a
No
cough.
idea what you're talking about.
Other people, it gets much worse.
Here it comes.
Sure.
Yeah. You go back to November, nothing. Now here we are, December, January, February, March, April, May, 6 months. Totally different world.
I mean, I kind of saw this whole thing play out in China before it played out in the U.S. So it's kind of like watching the same movie again, but in English. I mean, I think the mortality rate is much less than what say the World Health Organization said it was. It's very much less. It's like probably at least an order of magnitude less.
Well, it seems to be very deadly to very specific kinds of people and people with specific problems.
You can look at the mortality statistics, by age and whether they have comorbidities. Like, do they have basically existing conditions, and by age, if you're below 60 and have no serious health issues, the probability of death is extremely low. It's not zero, but it's extremely low. It's almost like people really wanted a panic. So it's quite crazy.
But in some places, a panic is deserved, right? Like if you're in the ICU in Manhattan and people are dying left and right, and everyone's on intubators, and
they absolutely did know. What? What the fuck is this? They absolutely fucking did know that it is lethal to a specific percentage of the population and not as lethal to others. That is so dumb. What the fuck? I'm criticizing Joe Rogan because his implication was that, maybe they didn't know. Like, that's a loaded question that he's asking Elon. It's bait, okay? But the loaded question implies that, maybe they didn't know in the beginning what it would do to other communities, like younger, healthier people. Let's say you fucking get it. Like, the percentage of people that get it asymptomatic, we still don't know. But let's say you get it and you recover. Like, do you still want to have fucking walking pneumonia? Walking pneumonia still permanently reduces your lung capacity. Like, even if you're totally fine, you don't even need to be hospitalized, totally fine by coronavirus standards, because you didn't have to be fucking tubed, okay? You're still not totally fine. And beyond that, especially in America, 60% of our population has some underlying chronic condition.
Most of the hospitals in the United States right now are half empty. In some cases, they're at 30% capacity.
And is this because they've decided to forego elective procedures and normal things that people would have to go to the hospital for? It seems like the state of public perception is shifting.
It is. Like,
people are taking some deep breaths and relaxing, and because of the statistics and essentially across the board, it's being recognized that it's not as fatal as we thought it was. Still dangerous, still worse than the flu, but not as bad.
Number one cause of death in the month of April that lapped fucking heart disease, which is usually the number one killer in the United States of America, with the underreporting that we've seen. The speculation, at least from experts, is that we are underreporting the number of COVID-19 deaths currently, even in this day and age. Incredible. 80,000 people. 3,000 a day are slated to die into July.
Do you think that the current way we're handling this, the social distancing, the masks, the locking down, does this make sense?
Well, I think proper hygiene is a good thing no matter what. Wash your hands and if you're coughing, stay home or wear a mask. This is not good. Like they do that in Japan. That's like normal.
Yeah.
If you're ill, you wear a face mask and you don't cough on people. I think that would be a great thing to adopt in general throughout the world.
You're dumb as a motherfucker if you think we're underreporting the numbers. We literally are. We're not doing it deliberately, but we absolutely are. Stay-at-home deaths, nursing home deaths, deaths caused by other underlying conditions. There's a way to look at this, right? There's a way to look at deaths in similar times like deaths in the same month of April this past year, and then compare it to the additional amount of deaths that we have and how much more that number is like subtract the coronavirus deaths that we have reported to see what the actual number is. There's excess deaths that are not accounted for to the tune of 12% in some places.
You know, at some point there probably will be a pandemic with a high mortality rate. You know, there's debate about like what's high, but I mean like something that's killing a lot of 20-year-olds, let's say, young healthy people. That's you know, define that as like a high mortality. Then this is at least practice for something like that. And I think there's you know, given it's just a matter of time that there will be eventually some such pandemic.
Do you think that in a sense, the one good thing that we might get out of this is the realization that this is a potential reality, that we got lucky in this sense? I mean, in people that didn't get lucky and died, of course, I'm not disrespecting their death and their loss, but I'm saying overall, as a culture, as a community, as a human race, as a community, this is not as bad as it could have been. This is a good dry run for us to appreciate that we need far more resources dedicated towards understanding these diseases, what to do in the case of pandemic, and much more money that goes to funding treatments and some preventative measures.
It's not really a dry run, is it?
Absolutely.
If
and
almost
I think
80,000 people are going to die by the end of this
highly
month.
likely, I think, coming out of this, that
it's not really a dry run. It's pretty much a wet run. It's the most wet run you can have.
When you made a series of tweets recently, I don't remember the exact wording, but essentially you were saying "Free America now." Like, let's
that is
open
the exact
it back.
wording.
That is it. Thank you. But what was how much do you pay attention to the response to that stuff, and what was the response? Like,
Elon be like, "Why are we running on journalist mode? Let's just make it more difficult. Let's play on hard mode. What are we, a bunch of pussies?"
Did anybody go, "Hey, Elon,
look, come on, only 80,000 deaths on journalist difficulty. Come on, let's fucking increase the stakes a little bit."
Well, I mean, I certainly get that. There's no shortage of negative feedback on Twitter, you know.
Oh yeah, Twitter. Yeah, but I don't read that. Do you?
Let's reduce all matter of functional and valid criticism of Elon Musk creating chaos on the liberal side of the fucking political spectrum by being like the science guy who is literally going against the scientific consensus in this circumstance. Let's look at that as just simple, like people getting upset at that as just simple Twitter plebs getting mad.
Read it?
Warzone.
You do sometimes, though, right? You do read it.
It's just Twitter, bro. People are just haters, comments. Bro.
Like as a meme, Warzone.
Yeah.
I mean, people knife you good on Twitter.
It seems like there's something about it that's this newfound thing that I don't want to say abuse, but just I want to say that it's almost like, you hit the button and things blow up. You're like, wow, what else can we blow up?
While I agree overall with the mentality that like internet, the internet like dynamics revolve around that, and he's kind of correct, especially Twitch chat. Obviously, I deal with it every fucking day. While I largely agree with that, there is a significant difference between someone with Elon Musk's level of influence and even Joe Rogan's level of influence, for that matter, spreading misinformation that is harmful, especially from a point of authority that he has cultivated for years as the science guy. Like, he is the science understander. You don't get it. The CDC numbers are overtuned massively, not the fault of any news outlet or government statistics, but rather mischievous reporting from the hospitals themselves. They have economic incentive to correlate these deaths to COVID-19. Wrong. Hospitals have every incentive currently and financially to underreport COVID-19 deaths so they can get back to their main moneymaker, which is elective surgeries. So you're fucking double wrong. You're quadruple wrong. You're just wrong. Wrong. You're so wrong. It's making me mad. So condescending in your fucking ignoramus attitude. You're like, actually, hospitals have a financial incentive to over-report so they can get more funding. Yeah, the funding is fucking crumbs in regards to like hospitals actually working at regular capacity. What about all the fucking hospitals that are literally piling on dead bodies out of fucking freezers? Is that made up? Fuck me. Fuck. So stupid. So stupid. Why are you all so stupid? And so is Elon Musk. This is why I hate, like, it's funny to make fun of Elon for being a fucking total dipshit, okay? It's really funny that he gets owned over and over again, like, into oblivion, and it doesn't matter. He will never stop posting. And in a weird way, I totally fucking respect that as a poster myself. Designated poster. That's the poster's allegiance, okay? But there are fucking morons like this fucking idiot in my chat is like, okay, you're smarter than Elon because you got your info from CNN and Washington Post. Like, what do I do? That is the dangers of deliberate misinformation. That is the danger of Elon Musk being like, yeah, we gotta liberate America. Those same fucking mouth-breathing, sea cucumber-brained Andes over here would be making fun of the conservatives last week that wanted to say liberate Michigan. But now that Elon said it, it must be science. Doesn't matter what actual science is saying. Doesn't matter what the experts are saying. Elon said it was best. So that's what I believe in now. It is so fucking, it makes me so mad.
I find Twitter quite engaging. You know, don't like, it's not like they like I said, it's not like they know you. It's like,
Yes.
don't take it personally.
Did you feel the same way when CNN had that stupid shit about ventilators with you? I found that both confusing and
Yeah, that was annoying.
it was annoying.
It was wrong.
But it's also annoying as a person who reads CNN and wants to think of them as a responsible conveyor of the facts. I would like to think that.
Yeah. I don't think CNN is that.
I think it used to be.
It used to be, yeah. Like, what do you think's the best source of just like information out there? Like,
That's a good question.
You know, like it's
OAN,
hard to
brother.
find something that
Owen.
isn't.
OAN.
But there's not that many of them. It's
No.
hard, and not a location where like we are no bullshit.
Sure.
You know, we are no bullshit.com. Like the one place where you can say, this is what we know,
Yeah.
this is what we don't know, this is what we think. Not
He's on
this
Substack
person's wrong and here's why.
and
Like,
Rolling Stone.
oh, God damn it. You know, I can't. You don't know. There's a lot of stuff that is
Yeah.
open to interpretation.
Yeah.
This particular coronavirus issue that we're dealing with right now seems to be a great illuminator of that very fact.
So-
Well, I like what you said when you said that it should be a choice, and that to require people to stay home, require people to not go to work, and to arrest people for trying to make a living. This all seems wrong, and I think
Yes.
it's a wrong approach. It's an infantilization of the society. That daddy's going to tell you what to do.
Fundamentally a violation of the Constitution.
Yes.
Freedom of assembly, and you know, it's just. I mean, I don't think these things stand up in court, really. Yeah, I mean, it
Now we got the constitutional scholar Joe Rogan versus legal expert Elon Musk discussing. Well, they're both philosophers, they're public health experts, and now constitutional scholars at the same time, doing the classic, well, it's the law argument. This would not be held in court. I mean, come on. Yeah, no shit, dumbass. Who cares? Like, it's for the common good.
And it seems like at this point in time particularly, our resources would be best served protecting the people that are at risk versus penalizing the people that are not at high risk for living their life the way they did, particularly having a career and making a living and feeding your family, paying your bills, keeping your store open, keeping your restaurant open. There's two arguments, right? The one argument is we need to keep going, protect the weak, protect the sick, but let's open up the economy. The other argument is stop placing money over human lives and let's shelter in place until we come up with some sort of a decision, and let's figure out some way to develop some sort of a universal basic income plan or something like that to feed people during this time.
Yeah, my opinion is if somebody wants to stay home, they should stay home. And if somebody doesn't want to stay home, they should not be compelled to stay home. That's my opinion.
Do you think
if somebody doesn't like that, well, that's my opinion.
If somebody doesn't want to put fire extinguishers in their house and to have fire alarms in their house, it is a violation of their constitutional right to force them. You should not be able to find them. It doesn't matter if the entire fucking block catches on fire because your house erupted in flames. Sorry, I'm a big brain person. Okay? Sorry. What is this libertarian Andy nonsense, dude? It's so fucking dumb.
Some people have this absurd, like, view that the economy is like some magic horn of plenty. Like, it just makes stuff, whatever. It just, there's a magic horn of plenty, and the goods and services, they just come from this magic horn of plenty. And then if somebody has more stuff than somebody else, it's because they took more from this magic horn of plenty. Now let me just break it to you, the fools out there. If you don't make stuff, there's no stuff. Yeah.
It's almost like there needs to be a distinction made between essential businesses necessary for mankind's survival versus hair salons and nail salons and any number of other small businesses that are not essential, that are not deemed essential. And that distinction is an important one, especially delivery, for example, and that the stay-at-home measures is actually to protect those people who are working in those essential sectors that are still working to ensure that we can fucking survive and we can still get food, and that's the reason why we need to do these stay-at-home measures regardless of how much it boo-boo hurts. Myself included, and everyone else in this chat, including all the fucking people who are now unemployed in my community, everybody wants the economy to restart. The problem is, if you fucking turn around and you say liberate Michigan and stay-at-home orders are fascism, and you agitate and rile up the conservative morons who have already been duped by astroturfing to take the position that they're currently taking, then you're a fucking asshole. Okay? You are not a man of science. You're just a fucking asshole. All of you fucking liberal Elon Musk simps would never in a million quadrillion fucking years ever find yourselves agreeing with the lady who's screeching social distancing is communism because she wants to go to fucking Ben and Jerry's, or not Ben and Jerry's, sorry, fucking her hairdresser or whatever. You would never be agreeing with this person if it wasn't for Elon also advocating for the same fucking position. What's frustrating to me are liberal Elon Musk simps who are like, oh yeah, now I agree with those fucking idiots because my favorite daddy, my favorite science understander said that, this is bad. Remember when Elon also said that this was going to be wrapped up by the middle of April? I just want to point that out, that he was catastrophically incorrect back then, and he's catastrophically incorrect now. Also, China fucking locked this shit down after allowing people to leave China, which was bad, which also still implies that it's bad to not do social distancing. Like, how is Joe Rogan the smart one in this conversation?
It's difficult to filter what the information that's coming out of China to accurately really get a real true representation of what happened. The propaganda machine is very strong.
American companies have massive supply chains in China, like Tesla, for example. We have hundreds of suppliers, like tier 1, 2, 3, 4 suppliers throughout China. So we know if they are able to make stuff or not. We know if they have issues or not. Then China is back at full steam.
Why is Daddy simping so hard for China? You think, hey, Elon simps, why is Daddy simping so hard for China? You think he has a financial interest in maintaining his relationship with China, with the Chinese government? Maybe like a factory there or something? You have to be a little conflicted, right? Elon agreeing with Donald Trump on reopening the economy and like the Chud protesters. Also, Elon not really criticizing China at all, not really criticizing the Chinese government at all, and saying that like they're doing a really good job with lockdown measures. Okay. Well, those two things don't go hand in hand. Do we need crazy lockdown protocols and crazy fucking spread prevention methods that China engaged in, which we should? I agree. If that's what Elon is saying, I fucking agree with that. Then we shouldn't be reopening the economy, right?
This has been politicized, in both directions, really. So it's, which is not great. Where do civil liberties fit in this picture?
Yeah.
And
Fuck
what can
off,
the government
dude.
make you do? What can they make you not do? And what what's okay.
Right.
Yeah, I think
anytime someone makes a civil liberties argument,
do you think it's one of those
in a
things
matter
where
like this, they're
once
just fucking. That's
we've gone in a certain
virtue
direction,
signaling.
it's
He does not give a single shit about civil liberties, bro. Okay, get the fuck out of here. What fucking civil liberties are being infringed on? What? Oh, I'm sorry that they can't go get a fucking haircut for like a month. That's the civil liberty that's being infringed on, dude. They're protesting so they can work to feed their family. You small dent-headed fuck. I know. If only there was a fucking regulatory Leviathan-like body of control that has a tremendous, almost infinite amount of wealth that could fucking alleviate some of the stress, the financial burden caused by all of these fucking dumbass businesses closing. If only the government could fucking do what the government is supposed to do. Stop trying to act like these tactical wearing AR-15 wielding cocksucking motherfuckers are actually regular average Joe workers, okay? That's another thing that I'm really pissed off about, okay? These motherfucking Karens out here in their nice-ass F-350 fucking souped-up pickup trucks screeching like fucking hogs at state centers are not actually the people that are fucking screeching because they lost their jobs. They just want to go and fucking get a haircut. They openly admit it. You are a fucking idiot. It is AstroTurf by fucking billionaires like the Betsy DeVos family.
So something that would be helpful just to add from an informational level is when reporting sort of COVID cases, to separate out diagnosed with COVID versus had COVID-like symptoms.
yes.
Because the list of symptoms that could be COVID at this point is like a mile long. Then if somebody dies, was COVID a primary cause of the death or not? I mean, if somebody has COVID, gets eaten by a shark, we find their arm.
Okay. If after this take, you're still if you still support what Elon is saying here, you're just completely fucking brain dead. Go out and lick a telephone pole if you want at that point. Nothing is going to save you. Okay?
And the stimulus bill that was intended to help with the hospitals that were being overrun with COVID patients created an incentive to record something as COVID that is difficult to say no to, especially if your hospital is going bankrupt for lack of other patients. So the hospitals are in a bind right now. There's a bunch of hospitals they're furloughing doctors, as you were mentioning. If your hospital's half full, it's hard to make ends meet. So now you've got if I just check this box, I get $8,000. Put them on a ventilator for 5 minutes, I get $39,000. Or I got to fire some doctors. So this is a tough moral quandary.
What's the way out?
There is literally nothing that he's saying that is different than what you hear about like 5G coronavirus conspiracist anti-vaxxer moms, okay? The government can't give everyone money for food because the government's already in a lot of debt. Yeah, that's so weird when we're printing $1.5 trillion. We were printing $1.5 trillion every single day for like 3-4 days. That was so weird. Not a single person asked, like, what is happening to the debt here? But I guess that's okay. It's okay when it comes to the fucking poor people like yourself and your fucking family. Then the government has too much debt. The government has too much debt. Everyone suffers in different ways. Some more than others, obviously. I'm not discounting the experience of millions of Americans who lost their fucking jobs. But you gotta use your fucking energy for the right causes. Because without accountability, without demanding the government to do the right fucking thing, which isn't just reopen the economy unconditionally, you are putting more lives at risk. And not just your grandmother's lives, not just your grandma and your grandpa and your parents, who are now going to be forced to go back to work without the adequate safety measures. But you're also risking the lives of the fucking nurses. You're also risking potentially overloading our hospital system once again, which is already in a state of fucking disrepair. We all want to fucking get out. We all want to go back to our regular lives. It's just shocking and remarkable and dangerous, so irresponsible, so mind-bogglingly irresponsible that someone like Elon Musk could spread this kind of fucking misinformation just because, he wants the stonks to do well.
This is not a question. This is what is occurring.
And where are you reading this from? Where are you getting this from?
The public health officials have literally said this.
Sorry.
And like I said, this is not some sort of a moral indictment of sort of hospital administrators. It's just they're in a tough spot here. They actually don't have enough patience to pay everyone without furloughing doctors and firing staff, and
Yeah.
they're potentially going bankrupt. So then they're like, okay, well, the stimulus bill says if we get all this money, if we say if it's a COVID death, I'm like, okay,
Literally false. Now, this is just the most damaging conspiratorial nonsense. They would be incentivized to minimize the impact so that they could actually open the fucking hospitals back up, because they, just like you and I, know that the government is not going to fucking help them. And the government demonstrably did not help them. Hospitals get paid more if patients listed at COVID-19 on ventilators. The coronavirus relief legislation created a 20% premium or add-on for COVID-19 Medicare patients. There have been no public reports that hospitals are exaggerating COVID-19 numbers to receive higher Medicare payments. Jensen didn't explicitly make that claim. He simply suggested there's an avenue to do so now that it is plausible COVID-19, not just laboratory confirmed cases, can be greenlighted for Medicare payment. The initial $30 billion out of $100 billion in the grants dedicated to healthcare providers addressed the pandemic was dispersed according to the 2019 Medicare reimbursements. The second wave will focus on providers in areas heavily affected by the outbreak.
Right.
Snopes investigated the claim, finding it plausible. Finding it's plausible Medicare pays the range of Jensen mentions, but it doesn't have a one-size-fits-all payment for hospitals for COVID-19 payments. As explained by nurse Elizabeth Davis in her piece at veryhealth.com, each hospital has a base payment rate assigned by Medicare. It takes into account nationwide and regional trends, including labor costs and varying healthcare resources in each market. Then each diagnosis-related group, which classifies various diagnoses into groups and subgroups, is assigned a weight based on the average amount of resources it takes for care of a patient. Hospitals are making less money with coronavirus patients than they would if they actually were able to fucking keep the hospitals open. Elon Musk is literally correct when he says that hospitals need to furlough their employees. So if that's the case, then why the fuck would they add additional death counts? Like, why the fuck would they add additional death counts when they can just simply avoid it? If there was some mass conspiracy amongst all physicians and hospital administrators if there was some mass conspiracy amongst hospital administrators, then why the fuck wouldn't they want to get back to work by minimizing the impact? It is if you look at it simply from a profit motive, therefore it is in the best interest of a hospital, if they are working exclusively off the profit motive, to lie about the coronavirus numbers in the other way and underreport rather than overreport. I don't think it's happening either way. I don't think the hospitals are deliberately or physicians are deliberately overreporting or underreporting coronavirus deaths. But if there was a financial incentive, their incentive would work in the opposite side. Hospitals and doctors do get paid more for Medicare patients diagnosed with COVID-19, or if it's considered presumed that they have COVID-19 absent a laboratory confirmed test, and 3 times or more if the patients are placed on a ventilator to cover the cost of care and loss of business resulting from a shift in the focus. This higher allocation of funds has been made possible under the coronavirus aid. This argument is not what you think it is, for the record. They're saying that hospitals can get paid more if patients are listed as COVID-19 and on ventilators, but that doesn't mean that the hospitals are making more money overall. And it also does not mention that hospitals are doing this. The entire article literally falsifies this by saying that while the claim might be true, there is no evidence to it, and that doctors doctors are not fucking gaming the system. It's going to be safe to say the hospitals are losing a lot of money because of COVID, so they fudge the numbers to make up the difference, and they can't downplay COVID because they're legit burning people outside in mass graves. Well, if they're fucking burning people outside in fucking mass graves, or if they're piling up dead bodies into fucking freezer trucks, then obviously there is a significant problem. The reason why it's not the same in Nebraska as it is in fucking New York City is literally because of social distancing built into living in an area that is incredibly far from one another.
Clarity of information will certainly help, but altering perceptions, public perception from people that are basically in a panic. There's a lot of at least a month ago, we're clearly in a panic. I mean, right where, when you look around April 5th, April 6th, people were really freaking out. But here we are, May, and May people are relaxing a little bit.
Yes.
They're realizing like, hey, I actually know a couple of people that got it. It was just a cough, and I know some people that got it where nothing happened.
I know a lot of people who got it. I know 0 people who died. I mean, but I know a lot of people who got it.
Yeah, it's not what we feared.
What the fuck?
We feared something much worse.
Yeah, that's correct.
So the adjustment's difficult to make. So you said, first of all, we need real data. We need
just parse out the data. Don't lump it all together.
No.
And then if you give people just parse out the data better, clearer information about like I said, was this an actual COVID diagnosis, or was it or did they get the test and the test came back positive, or do they just have some symptoms?
So was it quantified? What was it?
Yeah, did that person die? Did they actually have a COVID test, and the test come back positive? And then if they died, did they die where COVID was? It doesn't have to be the main cause, but it was a significant contributor to their death. Or was it not a significant contributor to the death?
You had COVID.
Okay, but it doesn't matter, dipshit. They're still dying. In America, 60% of the public has an underlying medical condition that would put them in the vulnerable population. 40% have 2. More than 2, sorry. So, like, it doesn't matter. When 70,000 people have died, you can't just be like, well, some of them died because they were fucking fat. Okay, well, everyone's fucking fat, dipshit. What the fuck does that mean? Oh, well, what if they died because they had diabetes and then they got COVID-19? Okay, well, were they going to fucking die on their own from diabetes? Or did those 2 conditions meet up and fucking create the perfect scenario where they died? We should actually not even count AIDS-related deaths as AIDS, because you don't actually die from AIDS. You die from the fact that it destroys your immune system. Obviously, I'm a fucking big brain genius, okay? So why would we count AIDS deaths as AIDS when it's not actually the AIDS that kills you? Look at me, my big brain 5-head, dude.
Colds, and well, we don't say that they died of those flu and other colds.
Well, that's what's so weird about
absurd.
this. It's so popular. And I use that word in a weird way, but it's so popular that we've kind of forgotten. People die of pneumonia every day. People die of the flu didn't take a break. Oh, COVID's got this. I'm going to sit this one out. I'm going to be on the bench. I'm going to wait until COVID's done before I jump back into the game of killing people. No, the flu's still here killing people.
I mean, every year in the world, several 100,000 people die directly of the flu.
Yeah.
Not tangentially.
Right.
Not every
61,000 in this country last year.
Yeah. And we're only 5% of the world.
And then there's cigarettes.
So, oh man, cigarettes will really kill.
Okay, guys. Sorry. His point, even if his point was literally that they are all dying of cancer, actually, and we are like, they're dying because their heads got cut off, but they also had coronavirus, which is the example he literally used. He said someone dies in a fucking shark attack and we find their arm, okay, and their arm tests positive for coronavirus. That's a coronavirus death. That is the insane example he fucking used. And a lot of you dipshit Elon simps in my chat right now are trying to fucking avoid that. That's literally what he said. And that is such an insane, mind-boggling, psychopathic fucking example that has never existed in the history of fucking mankind, because he has to fucking exaggerate and lie to prove his fucking point. And even if that was happening, it's not happening. But even let's say that it did happen. So what the fuck's going on? Is everyone just all of a sudden dying of cancer? You cannot explain the additional number of fucking deaths. If that's the case, you literally cannot explain the additional number of deaths. So what's happening? Why did the fucking death rate of all of these people who have fucking cancer, why did it go so high? Why did it just explode out of nowhere? God, this is so stupid.